Now with a report on what's new in dentistry. Here's our reporter, Laura Windsor.
If you thought a trip to the dentist would have to be a painful experience, you need to think again. Just as breakthroughs in technology have changed many aspects of medicine, they have changed dentistry as well. We spoke with Dr. Kourosh Maddahi in Beverly Hills about some of the newest innovations.
We are living in the greatest period of dentistry. The technological advancements are in the types of equipment we're using to diagnose, and then the types of treatment we are able to provide using this equipment. Okay, so as an example, you used to go to a dentist and then they try to poke you with sharp needles and sharp instruments to find out if there's a cavity, right? Today, what I'm using is called a digital cavity detector. There's a laser light actually gets shined on your teeth, and the digital light gets shined back into the machine, and the way the reflection works, it tells you if there's an unhealthy tooth structure there, if there's a cavity, if there are materials you've got to be looking at. That's all. There's no more sharp, pointy objects and instruments going on your teeth. So once we get that, then we know there is a cavity. Then the type of technology we're using actually to treat that tooth is very different today. You know, how you measure success is actually when the patient comes in, says, okay, we're going to fill your cavity, but we're not going to use a drill, and we're not going to do any anesthetic. We don't have to numb you because we're going to use this drill-free system called an air abrasion. It's a powder and air coming out of a nozzle, and the powder and the air actually removes the cavity. So, and then on top of it, I tell them, while we're doing this, you can watch movies on your 3D glasses. So pick your movie. There are 180 movies that we have in the office. They go through the movies, they pick one, we put the 3D glasses on them. They're watching a movie, and I'm using this airless drilling on the teeth. They can't hear anything, it's just a sound of air, nothing else. There's no noise. And then in 15 minutes, 20 minutes, it's all finished. And I said, okay, you're done. So what do you mean I'm done? I didn't feel anything. You didn't numb me. My lip doesn't feel numb. So that's the enjoyment you get. The success is that actually you're changing the experience of dentistry. It's so wonderful. It's so great. We cannot do this procedure with everyone, right? What we have to do is that we got to get patients to actually go to dental offices, have the technology of the digital cavity the detective, to detect cavities at the early stage to be able to use this type of technology, okay? Now, what about those people that are actually having deeper fillings and they need crowns and things like that? What are we still doing for them? For those patients, you know, sometimes when we're working on a bottom tooth, we have to numb the whole jaw in actually just work on one tooth. Now we have a different type of anesthetic delivery unit that we can anesthetize one single tooth on the bottom. I don't have to numb your whole jaw. Because we're numbing a single tooth, we don't have to go through so much tissue and do so many different things to numb that tooth. The recovery afterwards is very easy going, and there's not much to recover from also. We put a sensor in your mouth, and we use 90% less radiation. Why? Is because that sensor is able to pick up so little radiation to capture the image. It doesn't need vast amount of radiation like a traditional X-ray. So with 90% less radiation, I take an X-ray with this sensor, and in 3 seconds it appears on the computer screen. Now the image is so much larger, and I can actually manipulate the X-ray in so many different ways. I can see actually in so many different ways if there is something wrong with this tooth. So it has increased my diagnostic ability to look at a tooth. In the near future, what I think is going to be happening, there will not be any more X-rays. There will be like ultrasounds, the way that the patient goes, a pregnant lady goes to a doctor, they do an ultrasound to see how the health of the baby. We can actually put an ultrasound on a tooth and see the inside of the tooth. We don't need to put it on a gum and see the inside of the root, see if there is any infection without actually taking any X-rays. Noiseless drilling is right around the corner. And also the material, they're constantly improving. So the filling materials that would only last a few years are going to last longer and longer and longer. So there's a lot of development. There's a lot of exciting things coming up.
Your teeth can be an indicator of your total health. Keeping them healthy also helps protect your health. This is Laura Windsor for the American Health Journal.